quite a large number of couples walk into our clinic telling me that they're planning a baby and it hasn't happened. They would like to know if there is a problem, what we can do, what they are supposed to do. So this video, we hope to be able to tell you some of the common problems that we see on a day-to-day basis, particularly related to male factor infertility, and a little information about how babies are formed in the human body. I'm Dr. Padmaja at Padmaja Clinic, Vijayawada, and I have been in this field of reproductive medicine for 25 years. As you all know, a baby is formed when an oocyte from the female partner and a sperm from the male partner meet to form a baby. For this to happen, every day millions of sperms are produced by the male partner. In every semen ejaculate, there should be sperms with a perfect head, a nice tail to swim forward and search for the oocyte, a good mitochondrial DNA to give the energy for this sperm to swim forward. And these sperms have to be able to go through the filtration process and stringent criteria that the female body has and be able to swim through the tube and reach an oocyte, which has a lifespan of 24 hours after ovulation. In the women, there are thousands of follicles, out of which one of them grows and releases a oocyte, which lives in the tube waiting for the sperm for 24 hours. So unless this male component is really active, it will not be able to reach the oocyte to make a baby. Nowadays, we are seeing a progressively decreasing sperm count over the last decades. In the 1950s, sperm count used to be around 60 to 100 million count. But nowadays, we are seeing most of the men have an average of maybe 20 to 40 million sperms. And this has been happening because of the increasing environmental pollution, increasing pesticide use that is there, increasing toxins in the atmosphere that we are breathing, the change in our lifestyle, change in the food habits, change in the stress levels, change in the exercise patterns, increasing incidence of obesity. So all these are playing havoc on the male reproductive system. And to have some understanding, men have a pair of organs called the testis, which is in a scrotal sac, which is outside the rest of the body, because sperm production occurs at 35 degrees and our body temperature is 37 degrees. After the sperm is produced, it is transported out and slowly undergoes maturation and continues along this pathway, acquiring nutrient supplies from the seminal vesicles and prostate, and comes out through the urethra in the penis along the same way as the urine comes out. So, if there is any abnormality in the production, if there is any infection of these organs, if there is any obstruction here, we do have a decrease in the semen production and the sperm quality. When we look at the microscopic examination of the semen, we see actively moving large number of sperms. But even if the sperm count is just around 20 million, if there are almost 70% normal and 70% sperms that can move forward, there will be no hindrance in the fertility status of the couple as long as the female partner is okay. Only when the count starts falling less than 15 million, or we see very few sperms or absolutely no sperms in the ejaculate, is there trouble. Sperm size and shape has to be perfect, because the entire DNA material that is packed for the formation of the baby is in the sperm head. The transport of that is only with the tail. We see nowadays a large number of abnormalities. The head can be big, the head can be pinpoint, the head can be double, there can be two tails or abnormal shapes. All these sperms are filtered out by the natural process in the uterus, in the tube, and they are not allowed to penetrate into the oocyte and make a baby. The reasons why we see more incidence of male infertility is that there can be hormone problems which contribute to the male infertility, and as I was telling you, there is increased environmental pollution, and we are seeing a higher incidence of obesity, diabetes, hypertension, even in young men, which is having an impact. One of the most modifiable factor is smoking. Smoke contains large amount of toxins which in susceptible men drastically causes damage to the sperm. So this is the best time to quit smoking, because it causes not only harm to your sperms, it causes harm to the rest of the body, and even the female partner by second-hand smoke can get affected. Alcohol in moderation or minimum, occasional social drinking is not so bad on the sperm count. But if it is a habit, it needs to be cut down. A regular program of exercise needs to be there. Means to tackle stress needs to be there. And a healthy diet which includes lots of green leafy vegetables, sprouts, seasonal fruits, plenty of water is absolutely essential. Sometimes because of different infections, the pathway out gets blocked. So in them a prolonged antibiotic course is necessary. In abnormalities in this, all these reflect as abnormalities in the sperm count. In case the count is less, if they are not able to achieve pregnancy naturally, one of the measures that we have is an Iui program. In an Iui program, the semen sample is collected, processed, all the seminal plasma, non-motile sperms, abnormal sperms are discarded, and only the normal sperms that can swim forward aggressively are taken into a small drop. And when the female partner is ovulating and we are confident that the oocyte is in the tube, this processed sperm is sent into the uterine cavity through a soft cannula. Then, because the natural filtration processes are bypassed, large number of sperms are deposited at the time the oocyte is in the tube. The chances of fertilization are much higher, and that is usually around 10% per menstrual cycle. One more reason why sperm counts come down is the presence of a varicose. Normally, the blood that is coming after processing in the testis goes back through the veins. If sometimes these veins have defective valves, there is a pooling of blood around the testis, and this leads to the increase in the scrotal temperature, causing a decrease in the sperm count. In these conditions, when there is a grade 3 varicose, going in for a surgery, getting these small veins tied up so that there is no backflow called varicocele or varicocele surgery helps improve the sperm count in 30 to 60% of the men if that is the sole cause of decrease in the sperm count. For an Iui program to be successful, we need at least around 10 million sperms. The lesser the count is, the lesser the chances of success is. In case we do not have that many number of sperms, because they cannot swim and reach the oocyte, we make sure that we take out the oocyte and fertilize it. This is called IVF. Naturally, the follicles that are growing in the tube, under anesthesia, we can go in through a fine needle and aspirate each follicle and pick up the oocyte. For that oocyte, sperms that are moving forward are inseminated per oocyte, and after fertilization and development of the embryo, this embryo is gently put back into the uterine cavity. In case there are a large number of abnormal sperms and we are not able to find normal sperms, then what we do is tedious search meticulously through the entire sample is done, and sperms are picked up, and for each oocyte a single sperm is injected through a pipette under magnification under the microscope, and once there is a formation of a baby, this is replaced into the uterine cavity. So with these advances in technology, even men with very low count and large number of abnormal sperms are able to have genetically their own baby. In case there is an obstruction and there is absolutely no sperm coming out, we can use a fine needle or take a small tissue biopsy and retrieve sperms directly at the site of their production, that is from the testis, and that sperm is used for ICSI to make a baby, and the baby is put back into the uterine cavity for implantation. Over the last 45 years, millions of babies have been born by these assisted reproductive technologies, making thousands of families. But what people need to realize is we are working with the raw material that the couple provide us. So to have a successful pregnancy with whatever technology is being used, we need eggs and oocytes of great quality, sperms with a good genetic material, an embryo that forms, divides, grows, that wants to survive and make its way in life, a uterus that is willing to implant and nurture this baby over 9 months. That is not under the control of the doctors. So when we get good material, we have excellent success rates. I hope this video was useful, helpful, and cleared some of your doubts. If you have any queries, do write to us in the comment box. We will get back to you. Stay safe, stay healthy, stay happy.